Have you ever experienced low back pain during squat and deadlift? Then you should check this out. What will most doctors and physio tell you if you're experiencing low back pain during squat and deadlift? Well, in most cases, the doctor will send you for a medical scan, give you a pain relief medication, and ask you to stop and rest. But once the symptoms settle down and you go back to the gym, it comes back again. On the other hand, most physios and professional trainers will start looking at your form of doing squat and deadlift and carry on further assessment focusing on the lower back region. In most cases, they will tell you you're experiencing low back pain because your form of doing those exercises is incorrect and ask you to do a motor control exercise and give you deep abdominal muscle strengthening exercise. Well, they are correct, but are they actually targeting the cause? Who knows? However, research has shown poor correlation between posture and lower back pain. At Pain Fit Physio, we undergo a whole body assessment to find the contributing factors for your lower back pain during squat and deadlift, instead of focusing on your lower back only. For example, in most cases, we have found that having a weak glute is actually the cause of lower back pain when you're doing squat and deadlift. And why is that? For example, if I'm doing a mini squat here, if I have a weak glute, it actually requires a lot more work for my lower back to get that hip extension movement on the top of the squat. Even though other physios have found that having weak glute is the cause of lower back pain during squat and deadlift, they normally just give you a glute strengthening exercise for it. But is it really necessary? This graph shows the relationship between the muscle length and the muscle strength that it can generate. As you can see, in this region is where our muscle can actually generate the most force. Once our muscle gets longer or shorter, it gets weaker. And in a lot of the cases, we have found when the muscle is weak, it's not because it's weak, it's because it's tight. So in this case, having a weak glute, if it's too tight, then keep strengthening will just make it worse. That's why in our clinic, we actually have a lot of athletes coming, not because of pain. It's because however how hard they train, they just can't see any progress and get any stronger. And in most cases, this is what we look for and what we treat for. So now, I'm gonna show you the self-glute release strategy you can do if your lower back pain from squat and deadlift is actually caused by the glute muscle. So all you need is a foam roller and a nice firm surface. So put the foam roller on the ground, place your glute right on top of it. And now, this is very important with bending this leg. Flex and extend this leg to move forward and back and release that glute. And same thing on the other side. All you need is to swap. Place your glute on top and using this leg to rock forward and back. So this is the self-glute release exercise you can do if the glute is the cause of the lower back pain from squat and deadlift. If you have any further questions, please contact our clinic.